My name is Letiria Rosario, and I'll be doing a postpartum assessment today. First, I'm going to grab my supplies, my stethoscope, my pen light, and my gloves, and I'm going to perform hand hygiene. Okay, perform hand hygiene. Okay, I'm going to go check on my patient.
Yes.
Hi, Miss Hannah. My name is Letiria Rosario.
Yes,
I'll be your
ma'am.
nursing student today.
Yes.
Okay, Miss Hannah, can you tell me your full name and date of birth?
Hannah Lee, January 1st of 1976.
Awesome. I'm just going to check your bed.
Yes, ma'am.
All right, Miss Hannah, I'm here to do your postpartum assessment. Is that okay?
Yes, ma'am.
Okay, the postpartum assessment is just going to involve a complete set of vital signs. I'm going to listen to your heart and your lungs. I'm going to check your breast. I'm going to check your bowel sounds, your uterus, and your fundus.
Yes,
And I'm going to
ma'am.
check your legs and everything and the back of your stitches.
Yes,
Okay.
ma'am.
All right, I'm going to begin. Okay. I'm going to put on my gloves. Okay, at this time, I'm going to grab my patient's vitals. I'm going to do my respirations, my heart rate, my blood pressure, my temperature, and pain. Miss Hannah, are you in any pain right now?
It's okay.
It's okay.
Yes.
1 being the least and 10 being the worst pain. Can you rate it for me?
Right. 2.
Like a 2?
Yes.
Okay, great. All right, Miss Hannah, now we have your blood, your vitals and everything seems to be within a normal range.
Yes,
I'm going to
ma'am.
begin by a breast assessment. Is that okay?
Yes, ma'am.
Okay, I'm going to be palpating around the breast and I'm going to be making sure to see if you have any nodules, any redness, swelling, or pain, any discharge. Have you noticed any of those things?
No, ma'am.
No. Are you breastfeeding?
Yes.
Okay. Has there been any cracks or bleeding or anything around the nipple while you breastfeed?
No.
Okay. Is the baby latching on correctly?
Yeah.
Great.
It's eating well.
Awesome. Okay, I'm going to begin by palpating around the breast to check for any nodules. Okay. Okay, great. You're breasting great. I don't see any nodules or any redness or swelling. You said you have no pain. There's no discharge or cracking around the nipples. Okay, great. All right, at this time, I'm going to go ahead and I'm going to listen to my heart sounds and my bowel sounds. Take a deep breath in. Hold up. Breathe in. Okay, great. Now that my heart and lung sounds are done, I'm going to go ahead and I'm going to listen to the abdomen. I'm going to be assessing all 4 quadrants. I'm going to listen first, and then I'm going to begin to palpate. All right, listen to the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Miss Hannah, before I begin to palpate, have you been to the bathroom to pee or to poop since you've been out of labor?
Yes.
Yes. When did you pee? Did you pee or did you poop?
I did a pee.
Did a pee? Was there any pain or foul odor when you peed?
No.
No. Any burning? Anything like that?
No.
Okay. And have you used the bathroom yet? Have you pooped?
Not yet.
No? Okay. Well, this is okay. With you just being out of labor, the nurses will give you a Coley's and it should help you poop, and that should make it easier. So just in case if you did tear, this will help with that, okay?
Yes, ma'am.
Okay. Now listen to my bowel signs, and I have assessed it before I begin to palpate. I'm going to go ahead now and I'm going to palpate my fundus, placing a hand. Okay. As I begin to assess the fundus, I'm going to go ahead and lay my patient flat so I can get a better assessment of the fundus. Okay. All right, Miss Hannah, I'm just going to lay your head flat.
Yes, ma'am.
Okay. All right, now that my patient's flat, I'm going to begin to assess my fundus. I'm going to place one hand below. This is to stabilize the fundus so we don't have it revert back. And I'm going to place my hand as I search for the fundus, both the umbilicus And as I have it there, I'm going to assess it. I'm going to assess it to make sure that it is firm, that it is midline, and at least 2 fingers below the umbilicus. Now I'm going to teach my patient. Miss Hannah,
Yes.
what I'm doing right now is I'm just assessing your fundus to make sure that it's firm, that it's midline, and that it's below your or at your umbilicus, okay?
Yes.
If you'll notice that if you have any heart bleeding, you can do a fundus massage as I'm doing now, and that'll
Yes.
firm back up the fundus, and that'll should decrease the bleeding, okay?
Yes, ma'am.
And just right there. Yes, ma'am.
Yes.
Okay. All right. Being that my patient has voided already, now I can assess the bladder, and I'm just looking for any distension or anything like that. And you said you had no pain or anything when you went to pee?
Yeah, it's okay.
It's okay?
Yes.
Was there any foul odor?
Just bloody?
Just blood? Okay. All right. Now that my bowel and my bladder is done, I'm going to move on to the perineum area. I'm going to be checking my patient for lochia. This is the blood that happens after the labor. Okay, Miss Hannah, I'm going to go ahead. I'm going to be checking your sanitation napkin. I'm going to be checking to see if it's rhubarb. I'm going to be checking to see the amount that's on your pad. I'm going to be checking the color and if there's any odor. Okay?
Yes.
When did you last change your pad?
30 minutes ago?
30 minutes? Okay.
Yes.
All right, I'm assessing the pad and I see that there is rhubarb. There's a moderate amount of blood. There is no odor. I don't see any clots. Ms. Hannah, when you're changing your sanitation pad, please be aware that if you are saturating your pad, each pad for more than an hour, or if you see any golf size clots, please let me know, okay? This could be a sign
Yes,
of
ma'am.
something going wrong, okay? But I see no clots, there's no foul odor, and the blood is moderate and it is rhubarb. Okay.
Thank you.
All right. At this time, I'm going to move down. I'm going to be assessing my patient for a episiotomy at this time. All right. Miss Hannah, I'm going to have you roll over to your left. I'm going to be checking your backside for to see your tears, your stitches, see if there's any hemorrhoids, to check your back midline for the epidural site to make sure there's no pain, swelling, drainage, or anything there.
Yes, ma'am.
Okay. All right. And can you just have a roll over really quick?
Yes.
Okay. I'm going to grab my pen light. I'm now going to be looking in the area where a cut would be. I'm looking for any hemorrhoids. I'm looking to see if the stitches are there and they are good. I'm looking to see, I'm checking for RETA, which is redness, edema, ecchymosis, drainage, and approximation of the stitches. I'm also making sure there's no bruising or pooling of blood back here. I'm going to check her spine midline where her epidural was to check to see if there's any pain, swelling, or redness at the site. All right, have you had anything going on back here, Miss Hannah?
No.
Okay, great. Okay, I'll just have you roll back over.
Yes.
Okay, Miss Hannah. All right, the last thing I'm going to do, I'm going to go down and I'm going to be checking your legs, okay? I'm going to be checking for generalized edema. I'm going to be checking for DVT or possible signs of DVT.
Yes.
That's going to include maybe either pain, swelling, redness, or one greater than the other leg, or any issues that you may have. Did you get up and walk yet?
Yes, I walked a few minutes.
A few minutes? Okay. I'm going to educate. Okay. I'm going to educate my patient that walking will help in increase circulation, that it can prevent DVT or clots, and it also can help with the tone of the uterus. Okay, so I'm going to check my legs. All right, I don't see any generalized edema. I'm feeling the skin. It's not warm, it's not red or anything like that. There's no swelling in the legs, okay? No sign of a DVT. That's great, Miss Hannah.
Thank you.
All right. Last thing I'm going to do is while I was doing my assessment, I've assessed my patient emotional status. She seems to be comfortable. She's not tearful or has any current signs of postpartum depression. I've educated my patient on her breast, on voiding and going to the bathroom, on signs and symptoms of clots or DVT, and my patient is all caught up. Okay, when she's all caught up, I'm going to put her back down in a position. I'm going to put her head back up. Miss Hannah?
Yes.
Okay. All right, Miss Hannah, if you need anything, please let me know. I'm going to leave the call bell in reach. If you need anything, please let me know.
Yes,
We would like to get you up and moving about, and hopefully everything will go well with the baby, okay?
Thank you.
All right. Thank you. Okay. As my patient is now sitting comfortable, before I leave her, I will educate her on six baths that she can take one, and it can last for about 20 minutes. She can take this 2 to 3 times. I will educate her not to use any tampons or douches and to remain from sex for 6 weeks. Okay, once my patient assessment is all done and complete, I am now going to go wash my hands. I'm going to document, and I'm going to put my patient back in the lowest locked position with the call bell in reach. Do you need anything, Miss Lee?
No, not yet. Thank you.
Okay, great. Okay, and that'll be complete my postpartum assessment.